Hello, everyone, and welcome to the Strength and Hormones podcast. I'm your host, Lauren Papanos, and today I'm super excited to have Dr. Kat Brown on the show. She is going to be talking with us all about the brain and cognitive changes that occur in perimenopause and menopause, how hormones play a role, and some of the things that we could do to be able to support our brain and cognition as we get older. So, Dr. Kat, thank you so much for being here and welcome to the show.
Thank you so much for having me. I'm happy to be here and have this conversation with you. I think it's great.
Me too. And we were just talking offline a little bit. She is an OB. And so we were talking a little bit about some of my birth story and things. And I think it's so cool that you're still you're attending so many labors. And I would love to just hear a little bit more about your background and your experience and kind of what led you to founding Winona.
Sure. So, yes, I'm a board certified OBGYN, and right now I'm located in the Philadelphia suburbs. And I trained and did my medical school here in Philadelphia, but I actually did an Army scholarship for college and for medical school. So I did my residency in the Army out in Hawaii, and I've moved all around the United States at different locations, just working at Army hospitals while paying back my time. So I've lived in Texas and Hawaii and North Carolina. And much of my career was spent on the OB part of OBGYN. For many OBGYNs, we spend the bulk of our career dealing with deliveries and all the complications thereof, but also dealing with more menstrual irregularities, fertility issues, all kinds of things. And unfortunately, as many women probably listening know, not a lot of time and effort was spent on, perimenopause and menopause. And it's not something that's in the forefront of education for doctors, unfortunately. But that tide is changing as we age as a population of female doctors. Our focus is starting to change. And so I started working with Winona in 2021. Actually, the founders of the company reached out to me because they had started in California, expanded to Texas, and we're a telemedicine GYN company that just focuses on menopausal and perimenopausal HRT. But when they were looking to move into Pennsylvania, they contacted me, as a potential doctor to join them. And now I serve as the medical director at Winona. So I take care of patients in several different states on the website, but also serve to curate some of our medical journal content. We're big into trying to promote education for our patients and making sure that we help enhance women's knowledge about their own bodies as much as helping to provide them with treatment options too. So I do that when I'm at home, and then I also serve as an OB laborist, meaning that I work as an inpatient OBGYN physician on a labor and delivery unit in the suburbs of Philly. We take care of all patients that come in, but I also deal with GYN emergencies, stuff that comes through the emergency room. Sometimes patients show up with no prenatal care or not even knowing that they're pregnant. It still happens in this day and age in 2025, which is fascinating to me. But yeah, so much of my career, I had focused on the OB part, and now I'm really, doing full circle and doing everything, because the other part of it too is that as an aging woman myself, I'm also going through this same transition as my patients, and so I'm currently perimenopausal. So this is really important to me because I'm also going through it. So I really like that aspect of really being able to share that journey with my patients and help them through it. So that's me in a nutshell. I'm also a mom of three and have a lot of hobbies outside of medicine. So it's something that balancing, and I'm sure as many of the professional women who probably listen to your podcast, it's for women, it's always for working women, it's always a balancing act and trying to find time for it all. So, but that's me in a nutshell. Yeah.
So cool. And I think it's so cool that you're caring for women all across the lifespan, right, of these different types of shifts, because we as women go through so many hormonal shifts and transitions, and they really influence so much of your day-to-day life, and the brain being one of those, which is really what we're going to unpack and explore today. So I would love to just start off by talking about the role of estrogen as it relates to the brain. I feel like it's probably one of the most important hormones as it relates to the brain. There's obviously others too.
Yeah.
But maybe you could just explore for us a bit in terms of what we know estrogen does for the brain
Mhm.
and why that matters when we're starting to talk about things like perimenopause and menopause.
Yeah, absolutely. So, I mean, really, estrogen is a powerhouse hormone for women. I mean, it really is the essence of our function in every part of our body. But in the brain specifically, it has a significant role in cognitive health. So, it really positively influences a lot of our brain functions like memory, learning, attention. Basically, our neurotransmitters can't function at their best without estrogen being part of that equation. And it really affects multiple regions in the brain. So as you're going through perimenopause and menopause, and those estrogen levels are declining, we can start to see negative effects in these areas. So cognitive decline, also just learning potential, ability to focus and to prioritize, and really keep your attention on tasks sometimes can be affected. And we can kind of globally refer to a lot of the negative effects that start to happen as one of the symptoms that we see very commonly, as we call it, brain fog. And it's kind of a blanket term to describe a lot of these little different things that are starting to happen as estrogen declines. And so that's something that's really important to recognize, that women should realize that it's not them, it's something physiologic happening in their brain that's causing these symptoms. Because I think that for many high functioning women that are doing, at the peak of their career, and doing multiple things, when all of a sudden you have these symptoms creeping in, it can be really, really overwhelming and really disheartening, but just debilitating at times too. And it can affect your function and your job as well. So I think it's important to consider all of that.
Absolutely. And are we seeing any differences in a lot of those more brain specific symptoms between the perimenopause and menopause time periods? Because, in perimenopause, there's can sometimes even be more of this estrogen dominance type situation, at least in like the initial stages. And then in menopause, there's more so this inadequate estrogen production. So, do you typically see women presenting with different types of brain and cognitive related symptoms based off where they are within that perimenopause to menopause
Yeah,
transition?
I mean, every woman's journey and timeline in this transition is unique. And so I think that, a lot of times women may notice some of the early changes in the brain fog and cognitive decline, but they're still able to manage it in perimenopause because your ovaries are still functioning. You're starting to have symptoms. There's this erratic nature of hormone release during that time period. So, it's a spectrum. As we age, that estrogen production declines, but it's also like this ebb and flow of hormones where, the estrogen levels are kind of like a roller coaster. And it's not so much that estrogen is dominant in that there's so much. I think a lot of women read those words and they think that they have excess estrogen, and it's not necessarily excess. It's more that it's just released in such an erratic fashion that there are these high peaks and these low lows, and it's back and forth. Whereas postmenopause, overall globally, the estrogen levels are much, much lower. So there's much more of a consistent pattern to a lot of the symptoms that can happen with cognition, and brain function postmenopause, especially for a woman who has decided maybe not starting hormone therapy and not supplementing, with an exogenous hormone, like, taking estrogen replacement therapy. So
Okay,
that's the main thing. But I think that, so the symptoms are more recurrent, more repetitive postmenopause, whereas they can be more unpredictable in perimenopause for a lot of women,
sure.
which can
Okay.
make it even more frustrating because you can't
Yeah,
really plan ahead, and you can't really, you don't know when it's going to hit you. It might hit you that day that you're having to do a presentation or having to do some big project at work. And that is the absolute wrong time,
sure.
for a lot of these things to manifest.
Okay. And I'm curious if you see any difference clinically with women that naturally go through perimenopause, through that menopausal transition, can take 7, 10 years, right, for that to occur versus like women that maybe have a hysterectomy and kind of have this like very fast drop off occur. Do you notice that women that maybe have a hysterectomy have worsening of the cognitive symptoms because there's not that gradual transition?
Yeah, I think, for women especially, having the hysterectomy itself, which, hysterectomy just being the removal of the uterus, shouldn't affect their hormone levels that drastically. But if they have their ovaries removed at the same time, and women that go through surgical menopause like that, do have a much faster onset of these negative symptoms. But most of the time, if your OBGYN that did your surgery is conscientious, and if they do the hysterectomy and the oophorectomy at an early age, most of the time they're going to be proactive about offering you and talking to you about the importance of giving you hormone therapy. Because really, if I mean, we're taught that if you do a hysterectomy before the natural age of menopause, which in the United States is usually 51, that there really is absolute benefit. And the recommendation is that we do give hormone therapy at least until that age that you would have gone through the natural transition on your own. So it's really a disservice if someone's not given that supplementation with hormone therapy. But yes, women that go through it surgically, it's much more of an overnight, change and onset of symptoms compared to the women that are going through it naturally.
Sure. Okay. And can you talk a little bit too, outside of brain fog, what estrogen role is in things like mood and,
Mhm.
things like anxiety, depression, and such? And are we seeing a greater onset of these types of issues in women during this time period?
Yeah. So yes, women that have a history of mood disorders like depression, anxiety, those symptoms and those issues can certainly be exacerbated because estrogen is absolutely vital in the production of serotonin in our brain, and all of those pathways and our in our moods, and basically in all of that aspect of how we function and how we make those connections in our brain. So it definitely can affect that. So when you have loss of estrogen, you're more prone to these depressive symptoms and anxiety symptoms. So and it can affect everyone, even women that have never suffered from depression, maybe never dealt with postpartum depression or anxiety, may start to notice these changes and these feelings in perimenopause. And it can be really disheartening because, all of a sudden you're dealing with all these other symptoms and then throw this on top of it. You feel like you're going crazy, literally. And then often what'll happen is if women seek care and they talk to their providers about how they're feeling and starting to sense, symptoms of depression or anxiety, they're often given an antidepressant or an anti-anxiety medication, which may help the symptoms somewhat, but because you're not getting to the root cause of actually what's causing this degradation of the mood symptoms, you're not going to help it fully without really getting to the bottom of it. When it's really the loss of estrogen from the brain that's really stimulating a lot of these changes, many women won't really feel like themselves, quote unquote, until they get put back on, put on hormone therapy. So that's an important thing. I would probably say more than 50% of the patients that I see at Winona that are coming to seek HRT have already been on an antidepressant for a few years. That's usually what they've been given. And I don't know about you, but like as a woman, if I go to a physician and really tell them like I just don't feel like myself and I'm having all these symptoms, when I'm given the first choice as an antidepressant, my initial thought is they think I'm crazy. And I think that's a lot of the response that many women get. And it's hard because you feel like you're not listened to or not heard, and it's a significant issue that can be affecting your life, that warrants appropriate treatment. And so I think that the more we talk about it and have these conversations, women can demand better and demand more.
Absolutely. Yeah. And I think more women are becoming educated too about some of these shifts that can occur and becoming more, having more autonomy, I suppose, in what's happening in their bodies and advocating for themselves better, which I think is so important that conversation is out there. And I think one of those pieces of this hormonal conversation is the adrenals and cortisol. And I think a lot of women experience this during this time period is that a lot of them that are working moms and dealing with running of household and working and all the stressors that come with that probably are having more of this adrenal dysregulation because of their stressors, but then there's also this hormonal transition that is causing some of these changes too. So I'd love to just explore a little bit more about what is happening with the adrenals and cortisol regulation during this time period and how does that play into the brain and cognition.
Yeah. So mainly as your body is starting to experience symptoms and you're starting to go through, especially in perimenopause, you start to have changes in your sleep function, and this can definitely it puts you in that high stress state. When your body is starting to go through hot flashes, night sweats, you're starting to have cognitive decline, you're starting to have all these the brain fog symptoms. It's like you're in a constant fight or flight state and a high stress state. And the insomnia that a lot of women experience, which is also another early perimenopause symptom, also affects that. And it almost like you get in this negative loop where you're constantly in this high stress state. And it's hard to break out of that, unless you do proactive things to try to help reduce your cortisol levels. because that stress hormone can impair your memory, it can impair your visual perception. Overall, high cortisol levels can even reduce your brain volume. Some of the researchers have seen. So, it can put you at higher risk of having that cognitive decline, at higher risk for having Alzheimer's disease develop, even poor performance in language. So, like, one of the most common things that a lot of perimenopause women talk about is like not being able to find the words, not being able to process, and the word is in your brain, but like suddenly when you go to speak it, you can't think of the word. And it really, it affects you so negatively, especially in a professional atmosphere, because it makes you look dumb. I mean, honestly, and it makes you look like you have impairment, like in that executive functioning of your brain, which is huge. And so that's something that, it's definitely worth, you have to be cognizant of it and aware of it so that you can start to make changes to reduce your cortisol levels. And a lot of the ways that we do that is to try to reduce stress, trying to do all the things that you can do naturally to help improve and reduce your overall stress state and reduce your cortisol levels, like through regular exercise, optimizing your nutrition, really trying to focus on your sleep hygiene, and really trying to improve your sleep quality. I think many of us as young people don't really realize how important sleep is. And as we age, it becomes even more important to try to prevent getting in this high cortisol state. We need decent sleep to be able to function optimally as human beings. And for the people out there that think that, like, oh, I can function great on 4 or 5 hours, you could function even better if you got 8 or more. It's so important. And talking as an OB who's been chronically sleep deprived most of my career, now that I'm perimenopausal, I see the direct effects of that. I am not the best doctor, mother, anything that I could be if I am sleep deprived. And so, it's something that we really have to make a priority for ourselves, to really reduce those cortisol levels and improve our overall functioning, because it affects us so much.
Yeah, and I've read before that during this time period that the adrenals actually they're not really as robust and resilient in their ability to cope with stress. Is that correct? And why is that?
I think, overall, as organs age and the function changes, we just don't, overall, we just don't bounce back as well as we could. And I think that's really what's happening to the adrenal glands as well. I mean, I'm not an endocrinologist, so I'm not as, well versed in speaking at like the cellular level, what's happening inside the adrenal gland, but that's my medical understanding of it is really that it's just the age of the organs, and just how we're able to cope with it, how the organ's
Sure.
able to cope with those changes.
Yeah, so it sounds like regardless of if you feel like there's symptoms in this area, we probably need to be doing some support during this time period, like starting at perimenopause to be able to support those adrenals. Is that right?
Yes, I think it's important. Yes.
Hmm. Okay, wonderful. So, shifting gears into another hormone that I think is really important for the cognitive piece of things, just kind of let's talk about the conversation around glucose and insulin. I think a lot of people are becoming more familiar with the hormone insulin, and there's a lot more conversation around, genetic things, type 3 diabetes, and that being, kind of Alzheimer's disease, and those being classified together. People testing for things like ApoE that could also predict risk for dementia and Alzheimer's. And so I want to talk a little bit about what are some of the things that we know about how this glucose and insulin sensitivity affect the brain and cognitive function.
Yeah, I mean, absolutely. So, fundamentally, glucose is the primary source of energy for the brain. And so, you need adequate levels of glucose in your blood in order for the brain to function as best as it can. So, and insulin is really a transporter protein for glucose, right? So, basically, it's a key player to really help regulate your glucose levels and regulate that glucose uptake into your brain cells. So, if you disrupt that process, like in situations where, people have insulin resistance, or if they, have a restrictive diet where they're not getting enough glucose as fuel and they're breaking down the glucose in their body, or if they have the opposite, if they have excessive glucose in their body, but then they're not able to use it effectively, it can just impair so many functions of the brain overall. And so that's the main thing. It's like the glucose is necessary for processing everything, like neurotransmitter production, communication between neurons in the brain as well. And so if that balance of glucose and insulin is imbalanced, and if you're not able to properly use both, it's going to affect your function overall, and just overall proper brain functioning will be, disabled for a lot of individuals. And so, it's interesting because type 3 diabetes is kind of like a buzzword right now. It's not like a recognized, clinical diagnosis. It's used more by researchers, but it's not something like if you went to the doctor and said, like, I think I have type 3 diabetes, they would look at you like you have three heads. So it's something that's more, like a term like that's theoretic to describe all these things that are happening behind the scenes. But I think that the importance of this is that, for all of us as human beings, like, we need to have a real functional understanding of how well the food that we're using as fuel is taken into our body, and how well it's utilized. And I think that it's important to take a look at your family history and how you have functioned, as far as, do you have signs or symptoms of insulin resistance? Are you getting screened regularly for, your glucose levels? And that's something that's really important as we age. Even if we've had no family history, as we age, we're much more at risk for having insulin resistance later in life. And for most women, especially in midlife, this can equate to sudden onset of weight gain, and the difficulty and, the problems trying to lose weight. A lot of women will tend to gather weight, and have weight gain, especially around the core, around their torso, the infamous belly that we have. And it really is a manifestation of some insulin resistance developing from a high cortisol state, and that can really, it's like this vicious cycle that happens. And so if you don't take the time to really mitigate some of your lifestyle, you know behaviors and things like that, to try to help optimize how well your body functions, you can kind of be in this negative pathway to developing, insulin resistance. And so getting screened regularly for, pre-diabetes and diabetes with a hemoglobin A1C is really important. And really making sure that you're focusing on, I think so much comes down to our nutrition, and really, looking at what foods we're eating, and trying to avoid a lot of highly processed foods. And, if I'm always trying to teach patients and family members about, like, scrutinizing what they're putting in their body, because I think it's so very important. Like, so many people are eating so many packaged and prepackaged foods without really scrutinizing the ingredients. And almost everything in America has sugar added to it. And when you're bombarding your body with extra sugar unnecessarily, it can have so many negative through effects after, and basically helping your body develop all these negative pathways and insulin resistance over time. So, I think that shopping the periphery of grocery stores, eating more whole foods, trying to really scrutinize, like, what food you're using as fuel, and really recognizing, what foods are bad for you, um, what foods are going to affect you negatively, and just trying to make sure you're incorporating exercise and movement into your day-to-day lifestyle as well is so very important to help kind of prevent this negative spiral, from happening.
Yeah, and I talk in we have a podcast episode that's from a few months ago, I believe, or maybe sometime last year, that it's called Nutritional Changes in Perimenopause. And in that episode, I explore this conversation more about what are some of these natural hormonal shifts that are happening, like this drop in estrogen, and how that impairs glucose metabolism. And so, how we need to be shifting what our nutrition looks like, and that we can't be eating the same way in our reproductive years when you're in your 30s and 20s, right, into your 50s and beyond, because we just have a completely different hormonal environment, which is going to impair how your body metabolizes the food that you eat. And so I think that's really important for women to understand, because I think a lot of times they maybe continue with a lot of the same dietary behaviors as they get older. Or, what I see a lot is, a lot of women just starting to eat smaller portions, but not thinking
Right.
about, well, what is within those smaller portions that I'm eating?
Right.
Are
The
we just
quality
eating
and the
crackers?
macronutrients.
Yeah, exactly. Like, just because we're eating, less calories, but they're all like crackers and fruits, and there's not enough protein and good healthy fats and fiber in there.
Yes.
We're still going to run into issues with this insulin sensitivity, and run into issues with insulin resistance developing, and you're already going to be more prone to it because of this drop in estrogen that's happening.
Yeah, absolutely. And it's something that I think that we can all learn more about. And honestly, like, medical education in America, and probably around the world, is kind of inadequate when it comes to nutrition. Like, so the best people to talk to you about nutrition are actually not your doctors, unless they've done additional training or unless they have, a special interest in learning more about it. We're given maybe a couple hours on nutrition education in medical school. There's just so much to be jam packed into those 4 years that nutrition is not really prioritized. But also, I mean, we can get in a greater conversation about healthcare in America, but like, our healthcare system is not designed to keep people well. It's not designed, as preventive. So I really think that we have to take the reins as patients to really do the education and get the knowledge that we need to be our best selves, because, our medical system is not the way that the infrastructure is not meant to help keep us well.
Yeah.
And unfortunately, I mean, the most nutrition education that I have received as a physician has been on my own time, doing my own reading books, but talking to nutritionists, talking to dietitians as well. And I've learned more in the last 10 years about nutrition compared to all my time practicing, for 20 years in medicine. It's crazy. So
Yeah. Yeah, I know. And a lot of times it's challenging for the doctor too, because there's so many things that you're focused on when you're spending those few moments with that patient. And if they have these questions, it can be a little bit challenging because I'm sure there's other more pressing items to navigate with them.
yes,
But that's what us as registered dietitians here are here for, is to be able to help you to be able to navigate that and to really understand like what that individualized care looks like and how that really fits into how the body is functioning too.
yeah,
But I'd
absolutely.
love to explore some of the conversation around HRT and hormone replacement therapy and how that can potentially support someone during this time period. I think that there is starting to become a more open conversation and dialogue around HRT and its potential benefits. But there are definitely still women that are apprehensive because of the Women's Health Initiative and maybe other types of information that are out there. And so I'd love if you could just clear up like what HRT really is and how it can potentially support some of these hormonal changes that are occurring.
Yeah, absolutely. I mean, basically, HRT, stands for hormone replacement therapy. Now there's more of a push in the medical community to stop talking HRT and really talk HT, or hormone therapy, because the goal is really not to replace everything that's lost, but to give your body back some of that hormone that it's no longer producing in adequate amounts to help your body function at its optimal level. And so for a lot of women, this can be very helpful. And we are still fighting, like you mentioned, the stigma of the WHI study, the Women's Health Initiative study, which was in the media, and there was so many negative press related to that. And really, there was this fear mongering of, HRT is going to cause cancer. That is probably the number one question I get from patients. Like, I'm suffering, I'm going through so many changes, I really need to feel better, but I'm afraid, is this treatment going to cause breast cancer? And more research is coming out, and unfortunately there's not been a lot of good research available that's palatable, I think, for most patients, unless you're in the space where you're used to reading medical journals and like peer-reviewed articles. There's not a lot of good positive information out there, and that's changing. I mean, there's a lot of doctors, especially in the menopause space, like on social media now, that are helping to share and get the education out there. But hormone therapy can be so beneficial for so many women that it's safe for them to take. Um, and some women may still have medical issues that make hormone therapy too risky. But overall, for most patients, without significant health risks like a history of a heart attack or history of personal cancers, most women are eligible to take hormone therapy, and can do very well with hormone therapy. And I think that the other thing for women to understand and recognize too is that hormone therapy overall is so much lower dosage than what we probably previously took as birth control. When we look at the fundamental difference between hormone therapy and birth control pills, for instance, I mean, birth control pills are synthetic hormones that are at dosages at a level to help suppress. I mean, the whole goal is to suppress your body's system, to suppress the ovulation, and to suppress your periods and your normal hormone functioning, which is why you have to take a break to have that period at the end of the month. Um, but when you look at hormone therapy, where it's never intended to replace or suppress your body's own normal functioning, it's a supplement to your body's normal functioning. So it's perfectly safe to start taking in perimenopause if you're having symptoms that are significant enough and bothersome to your lifestyle that you want to feel better and be your best optimal self. And then post-menopause, when the estrogen in your own body is not being produced in adequate amounts, hormone therapy can help bridge that gap. And overall, there are so many long-term benefits and beneficial effects on your body to supplementing with estrogen. Really benefits with helping your bone health, your heart health, helping protect against heart cardiovascular disease. And the latest research is that when you are able to take estrogen only, like if you don't have a uterus and you don't need the progesterone aspect of HRT, the estrogen alone, taking that supplementation does not increase your breast cancer risk. It's actually the combination of estrogen and progesterone that has actually been proven to increase breast cancer risk slightly. But it's still so much lower risk than taking a birth control pill. And unfortunately, and a lot of women need to recognize when they go to their physician to talk about hormone therapy, a lot of doctors are very easy and quick to prescribe a birth control pill because it's what they have the most experience with and what they have years of experience with their patients in prescribing. But that's the wrong answer for perimenopause and for postmenopause. Birth control pills are infinitely more dangerous and more bothersome and risky to your health than hormone therapy is. And so that's something that you should be aware of, that if somebody offers you a low dose birth control pill instead of actually having the conversation about hormone therapy, then they don't really understand the purpose and the benefits of what hormone therapy can do. And so just be aware of that and not take that easily. So
Yeah, and I think that's what's so challenging for women is that they can maybe sense too when they go to the doctor that maybe they don't feel super confident in their recommendation behind providing HT hormone therapy.
yeah,
And so the patient kind of senses that and picks up on it. And then they're already a little bit apprehensive, but they want to feel better. And so then they're like, I just won't do it because worry about cancer risk more than I worry about feeling better. And so then they just go about dealing with these everyday symptoms and living, quality of life that maybe is subpar. And that's just so unfortunate for women. And so, there's different ways that I think different physicians utilize hormone therapy for women. There's so many different types of estrogen and how it can be utilized, as creams or as oral. And then you've got progesterone and testosterone. And there's some people that are getting injectables versus pellets and so many different options. So can you talk a little bit to what are your recommendations within these options and what women should know about how to know what option might be best for them?
Yeah, sure. And before I get into that in detail, I also just want to add, like, if you go to your physician or provider and you start having this conversation about hormone therapy, and you sense that hesitation or that discomfort, don't be afraid to point blank ask them, are you comfortable with talking about this? And if not, can you refer me to someone who is? Like, because you don't, I mean, I think that the hard part in that is that you might have gone to that doctor for years. Maybe they delivered your babies. You love them, you respect them. And when they show discomfort, it makes you uncomfortable. But it just may be their background or education. And so don't be afraid to ask for referral to someone who is an expert, because that's who you really want to have the conversation with. But when it comes to hormone therapy, there are so many shapes and sizes and forms of treatment. And it really comes down to patient preference. So overall, my preference is to try to steer patients toward the transdermal methods, which is, basically creams, topicals, patches, just because by doing so, you're going to avoid that first pass in the GI tract with the liver. And so it tends to be a lot more, accommodating by the body. Your body tends to incorporate the treatment easier, less risk of side effects initially, less risk of GI side effects, especially. And so it's a little bit easier to incorporate. But that being said, the best treatment option for a patient is the one that they can incorporate into their day-to-day lifestyle, right? So if you're someone who already takes a few different vitamins or medicines in the morning, and adding one pill to your daily regimen is going to be a lot easier for you to remember than applying a cream or a gel, then you pick what fits into your lifestyle best. And the easiest way to find, the best treatment option for a patient is sometimes trial and error, honestly. I like to use the analogy if it's kind of like trying on clothes, right? Every woman likes a different cut of jeans or pants. Like you can't take a rack of clothes off the shelf and it work for every single woman. So we all have our own preferences. And this really comes down to what your preference is and what you can incorporate into your lifestyle. Because I might think the patch is a great option, but if it doesn't work for you, then, and if you're not going to remember to change it or not going to remember to take it, then it might not be the best option for you. And so I think that's the most important thing, is that, we do have all these different options, and it's really about what's easiest for you to incorporate into your life.
Absolutely. And it sounds like you're saying too that, at least in your previous response, that what the hormone therapy looks like in perimenopause is going to look different than postmenopausally, right? Because maybe you're looking at more so supporting progesterone in perimenopause versus estrogen and postmenopausally. Is that correct?
Sometimes. I mean, I think a
Mhm.
lot of women can still benefit from a low dose estrogen, especially if they're starting to see, like, I can take a look at a patient's constellation of symptoms when they give me a symptom diary to let them know. And I can tell, like, yes, they could benefit from estrogen support as well, as progesterone. And then, testosterone is something that we have to be really careful with in women. There's no FDA approved products for testosterone replacement in the US for women. They're all made for men. And so when we're using them in women, they're off label. And also testosterone is a controlled substance as well. So it's widely abused by the bodybuilding and athletic community in some, and I actually saw it abused by the military when I was active duty as well in the army. Like, soldiers were taking it to be able to lift more, run harder, run faster. And so it's regulated. And so, unfortunately, like with a platform like mine, which is an asynchronous telemedicine platform, we can't prescribe testosterone directly. So the way we do testosterone support is by giving a precursor hormone supplement called DHEA, and that's how we use that to help gently increase a patient's testosterone levels. But we have to take that into account if we're also prescribing estrogen, because the DHEA gets broken down into testosterone and estrogen when it's metabolized by the body. So, but I think that, we have to take all of that into account. But a lot of women, especially as they are kind of at that midpoint of perimenopause and getting closer to their menopausal transition, would really benefit from estrogen support as well.
Yeah, I
And
believe it.
if so, it can help to normalize or give them a normal baseline estrogen level, whereas their normal excretion of estrogen from their ovaries is so erratic, like I talked about earlier. Just sometimes giving them a low dose gives and restores that balance in their body that their body so desperately needs.
Yeah. And do you have a preference for women that maybe have already gone through menopause, say it's been 10 plus years, in terms of their ability to start on hormone therapy? Because I know some physicians, they want you to have started within 10 years of going through menopause. Others thinks any time is a good time.
Yeah. So there is data out there and there is research out there for us that shows that if it's been more than 10 years since you've gone through the actual menopause transition and actually stopped your periods, like, so by definition, menopause being that you've gone through 12 months without a period after the age of 50, it can actually be more dangerous for you to initiate hormone replacement too late. So there's this like magic window where it's the safest for you to initiate. So we know that if you've gone 10 years or more since your menopause transition, or if you're over the age of 60, if you were to start HRT, there can be an increase in your risk for cardiovascular events. And that's the main thing we worry about. And so in that population, it can be more risky than good. Now, that being said, another thing that we have a significant issue with as aging women is that we have loss of estrogen from the vaginal and vulvar tissues, is a significant issue. So even if you're not a good candidate to do systemic HRT or HT, after 60 or more than 10 years after menopause, you could still benefit from using vaginal estrogen. And that's something that we don't talk enough about, but that's something that all women can safely take, even women that have had a history of cancer, because the vaginal estrogen is not systemically absorbed and incorporated into your entire system. It really only helps those tissues locally. And so it's much safer than people think to be able to use that to help maintain your sexual function, bladder and urinary health. And it can be so important for that.
Yeah. And even like prevention of like bacterial vaginosis and
Yes.
some infections and things,
Yes.
right?
Maintaining
Yeah.
that pH balance. Yes,
Yeah.
absolutely.
Okay,
So,
wonderful. And if there is anyone who's listening who maybe has a family history of, any types of cancers where they're concerned about this, is there anything that you typically advise for patients to be doing alongside hormone replacement therapy? Like, is there additional screening or tests,
mhm.
or is there supplementation or things that you typically want them to utilize at the same time?
Yeah, I mean, I think that the important thing to consider is that if you have a family history of a GYN type cancer, like breast or ovarian cancer, that doesn't mean that you're going to get it. unless your family member who's had the cancer has been tested for one of those hereditary cancer syndromes. That's the only situation where your risk is so much higher than the baseline population. So specifically the BRCA1 or 2 genes, and there's more and more genes being, identified and recognized now that there are people are getting tested for. But unless you carry one of those genes that gives you that higher risk of having a hereditary cancer syndrome, you can absolutely be a candidate for hormone therapy. And the only thing that really I recommend is maintaining surveillance, having self awareness of your body. A lot of patients don't really know how to do a breast self exam or be aware of what their breast tissue, but it's really important for you to be aware of what your body feels like and what it's doing, but also to maintain regular mammograms. And when you're over the age of 50, to make sure you're watching bone density and that you're also getting colorectal cancer screening and that kind of thing. So those
Mhm.
normal things that we all need to do for health maintenance that are not so savory and not so fun. I mean, no one likes doing a bowel prep. No one loves getting their breast squeezed in a mammogram machine, but it's one of those necessary evils to maintain our health. And so it's really important to do that. And also, I think the other important thing to talk about too is that even if your doctor has a negative opinion of hormone therapy, or maybe they're not well versed in it, but they're your family doctor or your internist, it is so very important for you to be completely honest and transparent when you fill out a questionnaire, when you go to a care provider, and that you make them aware of what you're taking, because they are going to be up on the latest guidelines for what surveillance needs to happen. And it's important that they know like what medications you're on, what supplements you're on. That's something you never want to keep a secret from your doctor. Your tax professional, your lawyer, and your doctor, you should be 100% honest with so they can help you to the best of their ability.
Absolutely. Okay, wonderful. So tell us about Winona, how it works, and if a patient who is, on the other side of the country, for example, if they can get access to you and give us more details on that.
Sure, sure. So Winona is an online telemedicine health platform that is available right now, I think, in 34 states that we're in. So we're an asynchronous telemedicine company, which basically means that you do not need a live video visit or live phone call with a physician in order to get treatment. So we wanted to keep it that way so that women can contact us 24/7 whenever it's important for them to reach out to their doctor. You have ready access to your doctor that's assigned to you once you go through the platform. Onboarding is really easy. And if you wanted to check it out, you don't need to sign up to be able to explore our website. So if you just go to bywinona.com, there's a lot of educational information on there. But if you're interested in seeking treatment, you just plug in like what state you're in, and we'll let you know if we're in that state or not. And there's an online adaptive questionnaire that patients fill out that basically goes over the important medical history, medications, and we don't ask every single thing about your medical history. Like, we don't need to know that you broke your leg when you were 5. Like, it's not important to your women's health. So it's all geared toward knowing first and foremost, are you a safe candidate for hormone therapy or you not? We want to screen out those patients that might have high risk conditions that would make HRT actually less safe for them to take. And it might be that you might not meet criteria to get hormone therapy via telemedicine, but if so, that means you might need to see person in person. So we've had patients that come through and that on board that might not be great candidates for our platform, but I've given them a search tool to put into their zip code where they can find a menopause provider close to their home if need be. But it's nice. But we have our own pharmacy, so the medications are made directly for the patient and shipped directly to them, so they don't have to go and wait at the pharmacy line. You don't have to wait for authorization from your insurance. We actually don't take insurance on our site. There are some other sites that do, but that way there's less barriers and less roadblocks for you to get the treatment that you need. And you can message your doctor anytime for free. So the only charges that patients get are actually the cost of the prescriptions through our site, which patients really like.
Yeah, it's great. And a lot of times too, I find sometimes even just like the cash pay for prescriptions ends up being cheaper than going through insurance, right? So
Crazy, right? It's crazy that it could be like that, but true. Yeah.
yeah, wonderful. Okay, great. And so they can go to bywinona.com to learn more and sign up. We'll put the details for that below. And then is there any other information you want to provide on where they can learn more about you, Dr. Kat?
Sure, sure. I have a professional Instagram page that you're welcome to follow. I try to share as much educational information as possible. Patients ask questions on there. We respond. It's at Dr. Cat OBGYN. And so you can, reach me on there, follow. We try to share information. And we also at Winona have live webinars for patients to attend. So we do Q&As that are live like twice a month. We also do some like online workouts for patients if they want to be able to do, workout. We also have a partnership with a nutrition company as well. So if like a patient needs help and doesn't have access to nutrition support near where they live, they could do online through one of our partners. So that's another thing that we offer. But I think that the most important thing is just get out there, learn as much as you can, utilize the resources that are available. There's a lot of online education on our site at bywinona.com that's completely free for patients. Free resources as well. Like if you're not even sure if you're a candidate or if you are in perimenopause, there's like a symptom quiz you can take that can help you to determine like if this is right for you.
Wonderful. Thank you so much. We'll put all those details in the show notes below and really appreciate your time and expertise, Dr. Kat.
Thank you so much. It was nice having this conversation with you.
Likewise.